I'm Kriti Gera. I'm a second-year fellow at Moffitt Cancer Center. So I'm presenting at ASH 2025. So we looked at the cytopenias and infectious complications following CD19-directed CAR T therapy in patients with BALL. This is a retrospective study. So as we know, CD19-directed CAR T therapies have had high remission rates in ALL, but the immune effector cell-associated hematotoxicity is a frequent complication. The ALL hematotox score does predict prolonged neutropenia post-CAR T, but the real-world data is limited. So we conducted this study on 53 patients who received CD19-directed CAR T therapy at Moffitt Cancer Center from 2018 to 2025. So we had 53 patients, and we had 49 patients at the day 30, and then 46 patients at day 100 follow-up. So as you can see, there's one patient who died of grade 5 CRS, and 2 died due to early infection during the first 30 days. And then during the 31st to 100th day, one patient died due to late infection and 2 had progressive disease. So here is the baseline characteristics of all the patients. Median age was 36 years old, and the CAR T product, most of the patients got Bruxacel, and only 7.5% got the T-cell. And then lymphodepletion regimen was pretty much 50-50%, cladribine and the fluci. And then we also calculated the ALL HT score, and 38 patients were low risk and high risk were 15. So we saw that 51 patients developed at least one infection by day 100, and 29.8% of the patients had 3 or more than grade 3 infections. Early infections in 16 patients, and late infection in 17 patients. And as I had discussed the mortality earlier, so 2 in the early phase and 1 in the late phase. You can see the cytopenias at different time points in this graph. So at day 30, we had 8% anemia, 27% neutropenia, and 25% thrombocytopenia. These all decreased at day 90 at 3%, 21%, and 18%. And this is kind of looking at the early infection and the late infection and different types of infection. So we also performed the univariate analysis of factors that were significantly associating with cytopenias and infections post-CAR T. For the severe neutropenia, the ALL HT score, the high-risk patients were associated with higher number of grade 3 neutropenia. And similar for the grade 3 thrombocytopenia at day 30, the ALL hematotox score was associated with that. Interestingly, the fluci lymphodepletion therapy was associated with more risk of day 30 grade severe thrombocytopenia. And then at day 90, again, the fluci lymphodepletion therapy was associated with higher risk. Looking at the severe early infection, the ALL hematotox score again was associated with higher risk of early infection. And for the late infection, you can see the fluci lymphodepletion therapy was associated with more late infections. And then this is also important, that the hypogammaglobulinemia at day 90 was associated with higher risk of severe late infection. So this is important because that is something to be explored in terms of prophylactic IVIG. So in conclusion, the prolonged cytopenias and infectious complications are frequent after CAR T-directed therapy for relapsed refractory BALL. The ALL hematotox score actually effectively predicts hematologic and infectious complications post-CAR T. Hypogammaglobulinemia was strongly associated with severe infections, which is there should be more studies evaluating prophylactic IVIG. And interestingly, compared to fluci, cladribine-based lymphodepletion may have better outcomes in terms of cytopenias infections.